Yes, we are going to take a few minutes to discuss about oral health strategies, and that's my name. Yeah, I don't know whether it is important to discuss about these things, because I know most of us from childhood, we have always talked about oral health, and oral health is brushing teeth. And I know it is, so we are going to take very little time. You prepare your questions. But we shall learn that for us to have a good mouth, it is very important. Because the mouth is a mirror of the body. You see that one? I do not know how long it takes, especially ladies, to come to church. But at least I know that for them to come to church, they have to put some time. Sometimes they take some time in the mirror, check whether the hair is as I had planned it. Sometimes ladies can take long to decide, I'm now like this, but next week, next Sabbath, I have to come with the same hair, but now with the baby hair looking this side. Now today it was looking this side, but this side is going to look like this. So it is always good to go in the mirror and you check whether it is as you had planned it. Not so? And that is the importance of the mouth. You have ever gone into the hospital and maybe you're suffering from maybe malaria, and you see the doctor saying, open your mouth. Have you ever heard about that? Yes. Then or somebody checks on you and said, according to how I see your lips, have you been sick? So that one means that it takes us away from the fact that we are only talking about teeth only, but the whole body. Any diseases, someone can check about your nutritional status, and he will tell you that, I think according to how you are you stressed? Are you missing some things in your body? Depending on how you are. Our immune system, our lifestyles, and everything. So, in Corinthians chapter 6, the Bible tells us that, don't you know that your bodies are temples of the Holy Spirit, who is in you, whom you have received from God? They are not yours. You were bought at a price. Therefore, honor your God with your bodies. It means that if in your mouth, the one you're using is not what? Is not yours. Now, I have a question here. That mouth is not yours. Now, my question is, should God's temple smell? You have seen people with the smelling, where you're sitting with somebody the whole time, but when he's saying, sometimes they can come here and read the scripture, and you want to say which, and you don't hear very well. And when you say, happy Sabbath, someone, someone whose mouth has been what? Has been kept for a long time without being opened. And you feel you shouldn't what? Someone wants to tell you a secret and is your friend. Do you think it is good for someone whose mouth, so God's temple, to smell? No. Now, another question. Do you think it is good for God's temple to have pain? God's temple, which is your mouth or your body, do you think it is good to have pain? It is not good. The next one, do you think it is good for God's temple to shame you? You have seen people without teeth. Sometimes they can get ashamed. So, we want to answer some of these questions. Of course, I know you know the importance of teeth. You have just, you said the family which prepared was who? Yes. It has given our teeth some work. Not so? I think everyone has enjoyed the food. Yes, and of course it's going to help us. Anyone who has not enjoyed, you have missed. And if someone does not have teeth, you cannot have the physical breakdown of food very well. Because you have seen some people, if you do not have teeth, you just... But you know, the food is supposed to work when it is very well ground. Or when it is very in small particles. When you grind it into small particles. Some people, if you have ever seen some people by mistake, they have eased themselves along the road. And you see some seeds of maize. The way how they are, that's how they are there. It means they have not been what? Yes. But you must make sure that your food is what? Crushed very well. So that because for the enzymes in the body to work on the food, it must be crushed, that the physical breakdown which is crushing can be now worked on by the enzymes. If at all it is not crushed, the enzymes will not do anything. It is very big for them to do what? To work on. So, if at all you do not have such teeth, if you lost one tooth, you need to replace one. Because if at all you don't do it, what happens? You can keep your teeth clean, but what happens? Along here, you see where that space is. My thing is not working. I don't know why. It was working before I started. So, you're seeing there. But in that space where the tooth was removed, what happens if at all you do not have teeth? The body is going to react in a way that it will tend to close that space. And how does it do it? The opposite tooth, the one which remained, is going to be as if it is going down. If at all you have ever removed your tooth, you are going to find that place, the upper tooth is longer than it has been. The neighboring teeth, this side and the other side, they also tend to close that space. So in so doing, that space is trying to close. But as they are trying to do that, in this space, in the sides here, around there, it is creating unnecessary space. Do you realize? It is trying to close this one, but the other side, this space where it is coming from, it is creating unnecessary space. So in so doing, it is creating space and where food is going to be retained. And with the time, you are going to find also what? The teeth getting sick. That is why you hear people saying, the germ or the bacteria came from one tooth to the other. That when they start removing one tooth, another one does what? Yes. It is not like that. It is just because the moment you remove one, it increases more chances of the other because of having that space of what? Of retaining food. Now, another importance is about speech. You cannot preach the gospel without teeth. Can you come and say, praise be to God? When you are in evangelism, they may even think, praise, which praise now? Praise be to God. If you are the member of which family? This family which is singing for us. Matson. If you want to say, can we have Matson family? First of all, people are going to they're going to laugh at you and you shall be embarrassed. So it is good for us to have what? Teeth, so that you can preach the gospel very well. If at all you have someone who doesn't have teeth, sometimes due to different situations, some people who have what we call open bite. If you are young and you were sucking your thumb, it can happen that you have that space, even when you have all your teeth. That one will make you have an open bite. So when you get some money, you can go and they use what? You have seen people with braces. They can work on it and It comes fine. If at all it is a baby who is still young and is doing that, you can try to make sure you stop that behavior before it continues. Another one is about how somebody looks. The teeth can make somebody look good. Yes, can make somebody look nice. The moment you lose these teeth, you shall find that your facial appearance changes. It is very difficult for you to, you are going to, when your facial appearance changes, even your self-esteem changes or lowers. You look at that person, you check around the nose and the mouth. It is the same person, but someone, after losing teeth, there is a way how the bone which supports the teeth is in such a way that it undergoes what we call resorption, or it reduces in size when a tooth is lost. That's why you see some people, when they lose teeth, you see somebody is 70 years, but another one is 70 years, but they are looking totally different. Because one lost teeth before, another one is what? Is having them. That is the importance of teeth. So that is why we shouldn't lose our teeth. I have another question. Sometimes we have gum disease. And gum disease, there is pus which comes from there. And what is this pus made of? Pus is made up of what? White blood cells, bacteria. But where does this pus go? Where do you think it goes? You have seen somebody with such teeth? When you have teeth which are like this, in gum disease, there is pus in someone's mouth. But where does this pus go? It means it goes somewhere. Not so? Not so? But in your body, not so? So, let me tell you somewhere. There is also another pus there. Sometimes people can have, but after they go take some painkiller and the pus disappears. But where does it go? When you take medicine and it goes away, where does it go? I have a cartoon there describing. Now, when you have blood pus in your mouth or in your gum, it is able to move, and it can move in 3 ways. Pus from your mouth can move through the tissues. Pus in your mouth can move through blood, or even in the water in the body, one we call nerve, and can reach your heart. The moment it reaches your heart, it can cause diseases of the heart. You have had something called endocarditis, or the disease of the heart, because endocardium is the muscle of the heart, Among other things which can happen to you is having what? The disease of the heart, coming from the bacteria which is from your mouth. So that is why I'm telling that even when the mouth may not look so important to you, you need to keep it what? Clean. The teeth are not in isolation. That's why you can find somebody is having hypertension, somebody is having heart disease. These days there's a lot of heart diseases. A lot. If at all, and most of our doctors, when they are assessing us in the hospital, you do not hear anything about oral hygiene. They will say, go to the lab, go do scan. Somebody has high blood pressure, but you can never hear anything about heart or oral hygiene. Because I think we need to change our curriculum maybe. And we learn how to work on it. Teeth are not in isolation. I've never seen anywhere I've never seen anywhere, I think this is my 13th year of working on teeth, but I've never been anywhere in the hospital and I see teeth coming alone that we have come to treat us. Have you ever seen anywhere teeth moving the hospital? They are coming with who? With the owner. And the owner can have effects elsewhere in the body. So teeth are not working in isolation. Now, when you talk about dental caries, because when you talk about dental caries, which is tooth decay, 70% of us have dental caries. Out of us, if we are 100, we are having few people without teeth. And for children, 90% of them have. These days, you see teachers every time they are saying, we have birthday parties. And they are buying for our children what? Sweets, cakes. And do they brush after that? No. Is there any teacher here? Especially a nursery teacher. Do you have any nursery teacher in this class? Yes. Make sure when you give our children sweets, make sure you supervise them to do what? To brush. You see, someone has, those teeth are very common. For children, it is so much. It is so much. It is so much that we find 90% of children have what? And we are going to see the reason. Now, what is the cause? Usually, as I told you about, that is in my village, we cook using those cooking stones. I do not know if we have some of them in Kampala, but especially in the villages. If you are using these cooking stones, they are very good if you are mingling. Anyone who knows how to mingle, Carlo? Samu mukonjo, Sarias mukonjo here. You're there. Now, a nice mukonjo cannot sleep without taking what? Yes. And this one, I do not know whether the bakonjo in Kampala have adapted to mingling on gas or no. Because it is very difficult if you are not used. But I think for them now they are used because has to be a food which is taken every day at least. If you miss today, you cannot miss 2 days without. You can get sick. Yes, plus fish. So, if you are having this type of these cooking stones, you find that all these ones, how many are they? 3. Now, the good news with this tooth decay is that you cannot, if you remove one of them, it is like this food we are cooking. If you remove one of these stones, you cannot mingle. It has to be only what? All the 3. It is like God the Son, God the Father, and God the what? If you remove one, you cannot do what? You cannot. Now, the 3 of them are only 3, and thus we are talking about sugar, the tooth, time, and that's the bacteria. And let me explain it like that. If you can work on only those ones, you can avoid tooth decay. And you don't need to work on all of them. Just choose one of them, especially what we call time. When we target time very well, we have conquered tooth decay. When you see people who are kickboxing, when you are training in kickboxing, anyone who has done training of kickboxing here, you do not have to reach on someone and you start boxing the shoulders. You have to target the weakest point. Not so? It's like when somebody is abusing you. He knows that if I talk this word, he's not going to answer any more thing. So that is what we are using. If you conquer only one thing, which is time, we are going to finish tooth decay. Number 1 is that now we are talking about sugars. Now, the sugars, as you can see, the sugars, we are talking about carbohydrates and sugars. Carbohydrates, we are meaning, what are carbohydrates? That means the posho, potatoes, those energy-giving foods. Not so? They are the ones which cause dental caries. They are proteins, they are okay. Vegetables, they are okay. Other fat, they are okay, but protein, rather sugars. When we talk about sweets, sweets come from what? Sugars. They are processed carbohydrates. It means once we talk about sweets, biscuits, all of them come from what? From there. But when you give them what to eat, in the mouth we have normal flora. Normal flora is normal bacteria, which is always there. We have it in the mouth, we have it in the stomach, we have it in our private parts, we have it everywhere. But when you give it what to eat, it is going to change and make acid, as you can see that drawing. It is going to make that acid. And the acid, anyone who knows what the acid can do, if somebody pours acid on you, it can burn the clothes, burn the tissues, your muscle, burn up to the what? The bone. So that is what, when it happens, that it will keep on mpola. It will change after that acid has been formed. It will burn your tooth slowly. Now the tooth has different parts. The tooth has different parts. The tooth has different parts. You can see it will. There is an outside part called the enamel. This one is harder than the heart, harder than the liver, harder than any other part in the body. But unfortunately, people keep the liver very well, but the teeth are sick. Yet the tooth is harder than even bone. It will take you mpola. Someone was saying that it take you what? Process by process. Thank you so much. So the acid will take you process by what? By process. When you reach in this part, in the enamel, that white part you're seeing has no blood vessels. It does not pain. The middle part there is called the dentine. The dentine, it has something like straws, like tubes. So these tubes are the ones which connect to the blood vessel. Now this blood vessel is going to be the one which because where we have blood vessels is where we have nerves. And you cannot have pain without what? Nerves. So it means that when you have pain, it is going to be when the tooth has reached in this what? Middle part. So it means that the tooth decay will give you time to go into the enamel, no pain. Dentine, when it reaches in that middle part, what we are calling dentine, that third part, you can only have sensitivity. When you open your mouth, when you close the mouth, it is what? It is okay. So, after some time, so you can avoid extraction when you are in these parts. But when it is in the last part, when it has reached the pulp, that's when you can have overnight of pain. You can have overnight of pain. You can pray to God the whole night when the tooth is what? Paining you. The next part, the things I'm talking about is those ones. They are the ones responsible for tooth decay. Now you may not avoid some of them. But that's why I was saying we shall see. You see that baby taking syrups. Can you avoid syrups? Because you cannot tell the baby, a doctor, that now for me, I learned about teeth. I don't want what? Syrups. No. A child is convulsing. A child is very sick. Cannot say, I don't want what? Syrups. But 90% of our children have what? They take syrups, and of course, they need to be helped. And how do you help them? We are going to look at that. Now, how do you avoid this one? How do you avoid this one? We are having that, we are saying that of all ways, these ones we talked about, all these ones, the moment we have talked about sugars or carbohydrates, We have talked about sweets. Of course, sweets are carbohydrates which are processed. When I'm talking about sweets, it is too much. It is too much that for them, they need very few minutes to change into what? An acid. When you talk about bacteria, you can't avoid bacteria. You can't avoid food. You cannot remove teeth in your mouth. Are you seeing that we have nothing to do apart from attacking time? So it means that we have to make sure that whatever food goes into the mouth, we remove it immediately. That is why I was saying that we need to attack time very quickly. You cannot tell people that when somebody gives you a cake on a birthday, you say, me, I have what? I don't want to have tooth decay. That cake, no. When you cannot avoid food, you are going to die because of what? Of hunger. But you can avoid what? Can attack time. Meaning, the moment you take food, you need to brush what? Immediately. The moment you take that soda, because I know Adventists say, for us we don't take alcohol, so at least take a soda. Not so. So if you take that soda, that cake, you need to brush what? Immediately. Now, that is what we are talking about. Now, the principles. I know people are going to say, we know how to brush. We have been brushing. And that's why I brought this thing that somebody can show me how they brush their teeth. Do you have any volunteer? Someone is already helping me. We have a toothbrush here. You are not going to use your teeth. You are going to use this one. Any volunteer who can tell me how you brush your teeth? Because we have been brushing ever since we were born.
Like how we brush my...
Yes, how you brush your teeth.
Where it is? Because you refuse to come, let me do. Okay, the baton.
Okay. Any other volunteer? Yes. Okay. Thank you. Thank you. Now, many people will be brushing. Many people will be brushing, and when you are brushing teeth, we need to ask ourselves some few questions. Number one question will be, why do we brush teeth? The importance of brushing teeth is what we have talked about. You brush teeth mainly to remove what? The other food. Because we are saying we are removing the factor of what? Time. You cannot avoid food because you are going to die of hunger. You cannot remove teeth from your mouth. And you cannot remove bacteria because it is normal what? Bacteria. But what we can do is to remove food what? Immediately. That's the reason why we brush. Number two, we are talking about when to brush. And we are saying we brush immediately when we are going to what? After eating. Not so? Another important time is when we are going to bed. I know most of us, you brush in the morning, even before eating food. You wake up in the morning, as you're in a bathroom, you shower. You first shower, you brush your teeth, or you brush your teeth, shower, then you put on, go to work. Maybe at work you can have some breakfast. Now, it is like easing yourself before you go to the toilet. Because that is it. You have brushed, you clean yourself before you what? You eat. Because you have cleaned and now you are eating. And you're going to brush again. That is, I think, and most of us who have cars, you do not have time. You can even eat when you are going to work. In the car. Is there a toothbrush in the car? No. So, when to brush, you are supposed to brush immediately after food. If at all you do not have a toothbrush at church, you can rinse your mouth. Rinsing at least can help out. Can reduce. Then another thing is that you brush when you're going to bed. Why? When somebody sleeps, the physiology of the body, or the way how the body works, that the body functions reduce and somebody sleeps. One of the things which help us, the one that God put in our bodies to help us to prevent tooth decay, was saliva. We talked about the acids. You know the acid? The acid, when you remember your O-level chemistry, the acid has a lower pH. Not so? Or we can say that saliva has a higher pH. So in other words, we can say that the role of saliva is to dilute the what? The acid. So we can simply say that saliva dilutes the other what? Acid. So the moment you are sleeping, there is no saliva in the body. So it means that the functioning of the acid will work more on your teeth, more than the one who is what? Not sleeping. It is like you who is keeping quiet. You have tried, the moment you are keeping quiet for a long time, you're not producing saliva. The moment you open your mouth once and you say, Amen, someone who is around you. So it is always good to say amen, because it keeps saliva what? Yes. And to prevent you from what? From tooth decay. Amen. If at all you have ever slept at your home, maybe on a Sunday or on a holiday, you sleep without brushing after lunch. You sleep for 2 hours, but you wake up when your mouth is smelling. Have you realized that? Because saliva, when you're sleeping, it reduces in the body. That's why it is always important, before you sleep, you need to brush your teeth very well. Yes, in the morning you also need to brush, but the most important thing is before what? Before bed. What do you use in brushing? Some people will use this one. Some people will use sticks. But whatever you use is what? Is very important. But the reason why we prefer these ones is because the moment you're brushing, you can reach all parts of the body. Someone was was telling us how to brush, and usually the way how God created our teeth, they are not straight. They are some with the. I think I have an illustration here. You see those holes there. They are not actually holes. They are depressions on the teeth. It is normal to have them. So you cannot, the moment you're brushing, even in the sides they can be there. It is good for us to do what? To brush them very well. And how do you brush? There's a tongue there. For some of us, especially gentlemen, washing is always our problem. You can have a towel, a white towel, or a black towel, whichever. Brown. You can keep it for some good days. And you say, it is not yet dirty. And this is the way how this is the way how the towel is. The tongue is also like this towel. The moment you try one time to wash it, you look at the water which is coming from your own towel. You feel you cannot really believe it is your own towel. That is how the tongue is. The tongue also has this roughness. When you're brushing, please make sure you don't forget to brush your tongue. Because the tongue also has these towel-like structures. And it is always good for us to brush the tongue. We are saying, what do you use? We are saying we use a toothbrush. And people can ask that, which one is the best toothbrush? Well, toothpaste. Toothpaste, some people, when you go to Freedom City, I don't know the big supermarket around here, you are going to find around 20 varieties of what? Of toothpaste. There is a Colgate, there is Deodorant, there is ABC, there is what else? White Dent, Sensodyne, whichever. There are so many. But the most important thing is to brush using fluoride toothpaste. In our toothpaste, there is what we call fluoride. Fluoride is very important. In drinking water, we have fluoride. If you check on this water we buy from shops, the public health people, they put some amount of what? Fluoride. But it shouldn't be excess. That is why we are going to talk about later that children are supposed to use the toothbrush or the toothpaste for adults. So, fluoride is what we use. Why is fluoride important? Fluoride is very important because the moment you use fluoride on your teeth, fluoride has high affinity. High affinity is like, I can use magnetism. You know magnetism? There are some people who cannot stay alone. You have seen such people? The moment he checks you, tomorrow you see on the status that happening now at Cafe Javas. You have seen such people. So those people have high affinity. They cannot stay alone. That is also what fluoride has. Fluoride will get attracted to the tooth, and it will, in your chemistry game, it will replace some parts of the tooth, because fluoride can replace some parts of the tooth called hydroxyl ions. But it will come and push some parts of the tooth and replace them. So when it does that, it will make the tooth very hard. So if it makes the tooth very hard, in other words, fluoride will make your tooth very hard, to the fact that the moment the acid comes, maybe before you brush, it will find your tooth what? Very strong. So that's why we need to brush your teeth using what? Fluoride toothpaste. Of course, with what? With a toothbrush. Now, somebody has illustrated, but maybe I can also add on by saying you need to brush in a circular motion, because we have teeth in between. You have spaces in between the teeth, and the moment you do this, you are going to cause your teeth have what? To have, we call it abrasion, but I'm looking for a way how to simplify it. Friction. The friction here is going to make your teeth have some way of holes even without the natural process of tooth decay. So you need to be a bit softer because you are working on your body, which is God is the temple. There are some people when they are brushing, it is as if they are scrubbing talazo. Someone can scrub teeth as if it is. The scripture told us that it is God's temple. You cannot scrub God's temple like you're scrubbing talazo. You need to be a bit gentle. You take some time. You make circular motion. You make circular motion. Because the moment you do this and you're going to do another turn, food which was in between here, you do what? You remove it. Circular motion. There are some times when you owe some parts of the mouth where you cannot do circular motion. Now from this one, is why you shall do what? The way how our colleague was describing us. But majorly where you can, all of it you do what? Circular motion. And don't forget to brush the what? The tongue. For some people who are having electric toothbrushes, they have a capability of already circular motion. You don't need to do it. Just have to put it and it vibrates. Don't put what? Because they charge it like this one. You can see there are some people who have electric toothbrushes. You don't have to use circular motion. Some people can also use, Muslims like this a lot. The sticks. If at all you know you can use a stick very well, you can use it. Only that sometimes you find that it is very difficult to brush your tongue using that stick. It is not easy to brush some different parts of the mouth using what? That stick. But these sticks are what? Are very okay. Now, for children, I already said that for children you need to supervise. Why do we need to supervise their brushing? Because children are not supposed to use our toothpaste, because too much fluoride is very bad. We have people who come from Fort Portal. Around Fort Portal, there is, or even some parts of Kenya, there is a river which has too much fluoride. And you see their teeth have a bit changed color. Not because they are dirty, but because they are what? It is something like this. Have you seen people having such teeth? This is called fluorosis, too much fluoride. And fluorosis happens when children use adult toothpaste. It does not happen to them when they are young. It happens to them when they have adult teeth or permanent teeth. So it is very good for us to allow our children have their own what? When you go to supermarket, you shall find this toothpaste there for children. And you should supervise them not to swallow the what? The toothpaste. Because toothpaste has it is sweet. They will tend to swallow everything. Make sure they do not swallow the what? Otherwise, when they are old a bit, the permanent teeth are going to be like this. So, another thing is about syrups. The moment your child takes syrups, you need to make sure you get a clean cloth and you rinse the mouth. Rinsing using a cloth, it helps to reduce on the what? On the amount of syrups in the mouth. But people who don't do that. It is good to do it. We have something called flossing. Anyone who has a floss? Flossing is what I'm talking about. And that is there. Flossing is a thread. These days I went to some party, and after eating I saw people giving us a dental floss. Have you enjoyed such a party? A dental floss is used to clean in between the teeth. It is just like this. This is, I think, around 6,000 or 8,000 in the supermarkets. It is good for us. It has a cutting end. You just remove one and you do what? You close, you can throw this. There is too much inside. And here you use one edge, one thumb, another thumb with the middle finger. You do what? You clean. You can do it once a day. It removes food in between the what? The teeth. There are others which are made like that. It is good for us to have them. They are very important for us to have them. You can use them, and they are very good. Flossing is very important. And many people do not floss, but it is up to us, ladies and gentlemen, to learn how to floss our teeth. Another one is visiting a dentist. It is good for us to visit a dentist for checkup, because you can detect the tooth when it is not yet in a bad state. It can, when it is for cementing, we talked about early treatment. When it is in the enamel, you can cement it. When it is the dentine, you can cement it. But when it has already reached very deep, you have to do what? To go into for root canal, which is a bit expensive. Early treatment, all these ones, number one, number two, we can cement them maybe around 30, 40, 50, 60,000. Or even 100. But the moment it reaches here, it is going to be expensive for us and for you. Yet the church needs your money. The more you delay, the more costly it becomes. If you go, you can, if a small cavity, little money. You go with much, if you delay, it will be much. Diet. It is also good to avoid this food. Food which causes what? Tooth decay. And this is what I've talked about. Most of us like sweets. Sweet things are not very good for your teeth. If at all you cannot avoid them, the moment you take, you need to remove them from your mouth. But these things are very common. These days they put sugar everywhere, including milk, including even Rolex, including everywhere, even cakes, mandas, they put what? Yes. So, sugar used to be for only drinks, but now it is everywhere. Meaning we need to control our diet. Then you need to take good things. Those are very good for our health. Very good. If you can land on a sugar cane, it is very good for your teeth and for your gum health. As I'm finishing, you need to avoid things of, if you have gone to town, there are things, you hear people saying, akate mesi ebiku, nkuku ni mwenyera sembela wanu. Those are things, and people go and buy those things. Things which are not valid. They are not good. It is not good for you to just buy anything you land on the street. At least, I know sometimes people can have, but usually we emphasize you buy things with the label of UNBS, they could be very fine. Then there is also what we call scaling. You have seen people with such calitulas. If you check your mouth and you have such a thing, son or daughter of God, if you have these calitulas, you need to remove it. This thing is very bad. It will make your teeth smell. It is going, this calculus will push the tongue from where it is up to down, and it will make the gum, what you call gum recession, some part of the roots of your tooth be exposed. So you need to remove it by scaling. Scaling is done at least once a year. If you have never done it since you were born, plan to do it. You need to do it at least once a year. The books will tell us at 6 months, every 6 months. But at least you do it once a year. You need to remove those things. They are not good, because they are going to make a lot of what? Habits. A lot of problems. Habits, I know people we don't have many smokers here, but you also have to avoid these habits of smoking. Opening sodas with your teeth. Opening sodas with your teeth, it's very bad, because it will make your teeth have those cracks. It is very bad. we have a nursery teacher who promised us that the moment he gives our children sweets, he's going to monitor their what? Brushing. But cakes these days, it is an order of the day in the classrooms. You need to avoid as much as we can. That was what I had, and I can receive questions. May God bless you.